Comes to volumization, particularly with Ultra Deep, and someone like Christine, I definitely will now start laterally. I'm going to start out here, the most lateral point. And this is where I really want to start creating this volumization of the mid face. And I'll be using Ultra Deep here. So important thing is, again, retract. Close your eyes for me. Sharp scratch. So we're using Ultra Deep in the most lateral point here. Onto periosteum. Aspirate. And a slow, steady bolus. And already with 0.05 I can see the difference. I'll likely just use 0.1. That's point, and I'll be able to blend that in with my more anterior point. And this is the point of beautification. Right onto the zygomatic eminence, slow aspiration and slow infiltration. It's nice to go slow because it makes it more comfortable, but it means you just have more control over the actual placement of product. Now what can happen with Ultra Deep, because it's such a cohesive product, you will get these mounds. Now we want these. We want these to lift the skin and provide projection. And what you need to do sometimes is be able to contour in between these. So I will now add an extra point in between them to be able to blend this in. .2 so far in total. We'll look to do another 0.1. That is 0.3 mils in total so far of Ultra Deep at a supraperiosteal level. Now, some people would prefer to use a cannula in the medial cheek. I'm a believer in a patient like Christine where I'm not trying to distribute the product too much because she already has relatively good volume here, particularly on animation. I want a nice bolus to improve the volumization medially. So as long as I'm not in line with the medial limbal line, I know I'm safer more laterally. And as long as I go in and aspirate, I'm looking to place here 0.1 mil here. Doesn't require a large amount of volume in someone like Christine. I've treated the mid face. all at a deep level. My next step would be to come down to the lower face, where I know I want to lengthen the face and use a deep volumizer, and in this case ultra deep, in the chin at the tip of the mentum to lengthen and hence narrow the face. I will start with the chin before I go onto the jowl itself. So this is essential that when we go supraperiosteally, we then pinch and inject, and I'll show that technique. Perpendicular to periosteum, onto periosteum, aspirate. Now this is key. You fix on periosteum, pinch either side, because you do not want the product to spread underneath the muscle, and slow injection here. Now we're trying to lengthen inferiorly the chin in this area. And I'll use max in this area, 0.2 mils. Sometimes with the chin, because of the space under the muscle, almost acts like the galea. It can spread. You've got to be able to contain the product as much as you can. So hence why I pinch, and hence why I just may do a little bit of subtle molding right at the end. You do not want to over mold in this area, because you don't want to spread the product too laterally. You want to retain that projection at this area, and that's one of the other benefits of Ultra Deep. It is moldable, but it isn't as moldable as RHA4, and a patient like Christine is therefore more suitable to this area. So now treating the jowl, you can see I've marked out where exactly I'm going to go. You have to ensure you're in front of the mandibular ligament. Behind it, and you are worsening the marionette and worsening the jowls. Again, I like to retract here. I'm going onto bone, sharp scratch, straight onto periosteum, aspirate, and slow injection here. Now here, I almost want it to spread. I want it to go slightly medially and slightly laterally. 0.1 is sufficient at a deep level in this area. And it may require just a small press, a little bit of pressure to give it that little bit of extra push you want it to go at the deep level. Just with volumization of the deep fat compartments, we can already see a significant change in the contour and shape of Christine's face. By placing Ultra Deep laterally here, RHA medially, ultra deep in the chin area here and in the jowl, we can already start to see feminization of the cheekbones and a slight widening of the cheekbones versus the gonial angle, leading to a more female heart-shaped face here than the square on the left-hand side. Now this is just with deep. What we then have to do is treat the superficial fat compartments for a contoured effect to further enhance the lateral cheek and also the jowls and the jawline, which we will do next. Stage 2 of the sandwich technique is going to a more superficial plane, and for this I'll be using exclusively RHA4 because I know I can use it in multiple anatomical planes. First step will be to further contour the cheek area to create more lift and more definition. The more definition is really to try and achieve a more female face shape to widen the cheek versus the jawline. Secondly would be to use RHA4 subcutaneously in a fanning pattern around this area here to create the lateral lift I'm looking to achieve to try and improve the lower third. I've marked out this area here because this, as I said before, is a no-go area. We do not want to worsen the jowl fat. I will then move to treating the labiomental fold to try and improve the shadow here and lengthen the chin even further on top of what I've put into the mental tip with Ultra Deep. Improve anterior to the jowl here by using RHA4 again subcutaneously to define this aspect of the jawline, and then finally I'll go more posteriorly to the actual jawline here behind the jowl fat because I don't want to worsen it, to define this area even further. But I leave that at the end because what I want to be able to do is lift in these two directions first before I come to an area such as this. Okay. So again, using a 25 gauge 38mm cannula, which is my preferred option, I'm going into the superficial plane. And I like to mark the superior and inferior aspect of the zygomatic arch along which I want to provide this contour. Now, what you don't want to do is you don't want to be too superficial that you're just under the skin. You want to be within the fat, which I can see I am here. So, and this is linear threads, and I've put a little mark here just so I know that's the zygomatic eminence where I want to deposit a bit more product to create and enhance that point of beautification even further. And it's slow injecting. You want to place smaller amounts more laterally and more medially, so you enhance the shape of the zygoma and not create just one even block of filler. Again, large amounts are not required because with RHA4 immediately I see the results of what I'm placing in. I'm already at 2 mils. What you can do now is go down, angulate your cannula perpendicular to the skin and place a further bolus. So a total of 0.2 mils used superficially in the cheek. I'll go more inferiorly. Again, I'm wanting to create that lateral lift here. And this is because we're fanning out now, we need a little bit more product here. Subcutaneously, small threads, ensuring that we're laying them out nice and evenly without creating a bunching of the filler in one spot. If you're in the right plane, should glide seamlessly. You may notice some retaining ligaments which may cause a bit of opposition, but not always. And I'll expect to put in about 0.5 mils in this area here. If you do meet any force of resistance when you are using cannula, the most important thing to do is not force it, but probably inject a little bit and go anterograde to try and open that plane up. It's what we call hydrodissection. It can sometimes work beautifully. That is a total of, I ended up using a total of 0.7 mils there. So again, now you may see immediately accumulation of the filler, but the beautiful thing with RHA4 is it will start to disappear once you massage it. Again, it comes back down to the fact that it has some strength, it has cohesivity, but it also has stretch and it's moldable. So a product, again, that is suitable at different planes to achieve different things. Now again, this is just a temporary massage before I do my full massage at the end. So next step is to treat the labiomental crease to further improve the contours periorally and in the chin. And this is an area, because of the convalescence of all the nerves in the midline of the face, it can be a little bit more uncomfortable. So I always warn my patients. I also ask them to open the mouth so they're not tensing orbicularis oris, so hopefully the cannula should glide through a little bit easier. But again, using a 25 gauge 38mm cannula with RHA4, and I like to treat one side first, marked out the midline, and here you really want to be above muscle. You do not want to be too deep in this area. And this is an area where anterograde injection is best suited for comfort, but also to achieve the result you want to. Small threads. Total so far I'm up to 0.2. All we're trying to do with this is really mask the labiomental crease and try and extend out the chin even further than what we've put in with Ultra Deep at a supraperiosteal level. Next step is to treat just in front of the mandibular ligament, and this is what I'm going to try and do to mask that jowl even further and extend the chin out. Again, you're going subcutaneously, you do not want to be too deep. And this is when you've got to take into account the mandibular ligament, which I like to come slightly lateral to, and ensure I'm staying medial when I'm injecting, but using your fingers to really identify exactly where you are. And you don't want to come too superficially, stay as close to the mandible as possible, and just again, fine threads. Again, the beauty of RHA4 is we're just massaging it into exactly where we want it to sit. Now, last step is to treat the jawline. Now, I'm going to make sure I've taken away my marking, but I'm going to make sure I don't enter that jowl fat and I don't deposit any product here. Now, the important thing on a female face is you don't come up onto the mandle itself, otherwise that will masculinize it. You have to come slightly inferiorly to ensure you're volumizing and creating contour lower down, otherwise you will run the risk of masculinizing the face. Again, subcutaneously in this area here, I've marked out all the way up to the gonial angle, which is where I want to achieve, and I will put down a deposit, a small bolus of about 0.1 this area, and then it just small threads back. Again, really vital you don't accumulate too much product in one area, otherwise you will get an accumulation. If you're unsure, just always stop, reevaluate, and you can enter back in with a cannula. That's a total of 0.5 mils in jawline there. And I've got to be careful because Christine, because she has some strong jaw muscles, I don't want to put too much there because I don't want to risk creating too much of a contour, but I just wanted to add some definition to the jawline to enhance and hide the jowls. Now, we can never get rid of jowls with injectables. What we can do is mask them by redistributing volume and creating lift. And that's what I've tried to do here. And you can see immediately, just with 0.5 mils, a redefinition of the gonial angle and an improvement of the whole jawline contour, ensuring that I'm not volumizing the jowl fat. And that's because I've projected inferiorly and anteriorly along here and the chin, and then posteriorly along the jawline and in the cheek itself. In summary, having now completed the treatment by replicating what we did on the right side of the face, on the left side of the face, we can see we have achieved a more feminine look and beautified the face by doing and using Ultra Deep in a deep supraperiosteal level in the mid face, overlaying it with RHA4 in the lateral and medial cheek. And this is really to try and widen the biomaxillary versus the gonial angle. We ideally wanted the face to go from a very square face to more of a heart-shaped face without doing any neurotoxin treatments to the lower face. Moving inferiorly to the lower face, I have used RHA4 in a subcutaneous plane to achieve some degree of lift. This allows me to start improving the jowl area. Subsequent to that, we use Ultra Deep at a supraperiosteal level again to lengthen the face. The summation of those two things, by lengthening the face and lifting the face here, creates a narrowing and a slimming appearance. And finally, I used RHA4 in the superficial fat pads of the jowls and along the jawline to define the jawline even further. There is now a definition to the gonium on both sides. Finally, we've seen the patient on static, and we also have to ask her to animate to show the effect of the fillers in a dynamic mode. So if you could smile for me, and you can see with smiling there's no bunching of the filler, there's no unnatural looks, it all looks beautifully symmetrical and natural because of the fact that we've used the right products in the right plane with the right technique.